Hi, everyone. My name is Macy Taylor, and I am going to be presenting my poster on an examination of the impact of COVID-19 related stressors and psychological well-being among Tennesseans. I worked on this project with Dr. Angela Bowman, who is a professor of mine, and Nikki Berlon, who is a PhD student in our Department of Health and Human Performance. Our objective was to measure whether the COVID-19 pandemic has affected the mental health of adults in the United States, specifically in Tennessee. And so some background on mental health. Mental health is defined as the culmination of our emotional, psychological, and social well-being. That definition comes from mentalhealth.gov. And then according to the US Department of Health and Human Services, depression is one of the most common mental disorders in the United States. Also, according to the US Department of Health and Human Services, 17.3 million adults in the US reported at least one major depressive episode in 2017. And 31.1% of US adults experienced some type of anxiety disorder at some point in their lives. So our methods for this project, we used an online survey through Qualtrics, and we distributed it on social media and with health and wellness students at MTSU. There were 312 total participants, and the survey had 31 items. These items included demographics, pandemic-related trauma questions, and mental health status questions. Our analysis was conducted using descriptive statistics and cross-tabulations. And then for our results in the mental health area, 48.5% of participants reported having depression prior to the pandemic, compared to 61.4% reporting depression during the pandemic. 64.4% reported having anxiety prior to the pandemic, and then 71.9% reported anxiety during the pandemic. COVID-19 related stressors were asked about in our survey, and 38.1% of participants reported loss of income. 28.3% reported loss of a friend or a loved one due to COVID-19, and 21.5% received a COVID diagnosis themselves. Participants who reported pandemic-related loss of income were also significantly more likely to worry about finances, report depression, and to report anxiety. Here is a graph that I made from our cross tabulations. And the blue represents before the pandemic and the black is during the pandemic. So you can see in every category that rates have risen during the pandemic from what they were previously. And that is for all of the ones listed. The same goes for anxiety. Once again, the blue is before and the black is during. So every single category that we ran these cross tabulations on, participants had higher anxiety after or during the pandemic than they did before. So for our conclusions, mental health problems are rising with the pandemic, and certain factors may be contributing more to the heightened numbers of depression and anxiety, including loss of income or loss of a friend and loved one. More recent data is needed because this survey was conducted in March of 2021, and interventions are also needed. Thank you very much for listening.